Hello, my name is Leslie Harmon, and welcome to my course research project for Foundations of Research at Walden University. The problem statement that I have defined is to investigate and identify the factors that contribute to childhood obesity in the United States. It's also intended to determine if the implementation of a standardized nutrition curriculum program in elementary and secondary schools will reduce the childhood obesity rate. The research questions I have chosen to address consider if the implementation of a standardized nutritional curriculum will resolve the childhood obesity crisis. Is there value in behavioral interventions? And is childhood obesity a precursor to adult obesity and chronic illnesses? Childhood obesity is a major public health crisis both nationally and internationally today, and has increased over the last few years. Policymakers are looking for ways to reverse this trend. More than 30% of American children and adolescents are overweight or obese. It's my belief that nutrition education and prevention, with the parents as the agents of change, facilitate a positive long-term lifestyle change with the children. As an industrialized nation, it is paramount that we take a look at the potential foundations for this epidemic and take a community approach to eradicating this epidemic. In July 2003, the Surgeon General Richard H. Carmona addressed the Subcommittee on Education Reform to communicate his concern for the fastest growing cause of disease and death in the United States, which is obesity. In the last 15 years, there have been federally mandated action programs to support the implementation or continuance of school nutrition programs that ensure that low-income children are afforded healthy and nutritious foods. A commonality that I observed in my research was that a few federally funded programs were prevalent in providing nutrition education and prevention directives. The Child Nutrition and WIC Reauthorization Act authorizes all the federal child nutrition programs, including the school breakfast, national school lunch, child and adult care food, summer food service, and the fresh fruit and vegetable programs and WIC. These programs provide the local schools with the tools needed to implement nutrition education and prevention guidelines for the children and the community. In my research, I looked at several studies that evaluated the cost-effectiveness of the nutrition education and intervention programs. The childhood obesity epidemic continues in the U.S., and fiscal crises are leading policymakers to ask not only whether an intervention works, but also whether it offers value for the money. Cost-effectiveness evaluations of childhood obesity interventions can provide decision makers with information demonstrating best value for the money. My proposed solution to eliminate this epidemic is to implement a more robust nutrition education program for the teachers to foster a greater awareness and accountability. Nutrition education programs that extend to the community and to the families have shown a great awareness and increase in identifying foods that are in the fruit, vegetable, and grain groups. The CDC conducted a school health policy and program study and noted that many schools are not adequately using their potential to promote student health and well-being. We have seen from these studies that the ability to foster healthy habits can be achieved with nutrition campaigns spearheaded by the school cafeteria and faculty that extends participation and awareness to the family and the community. Since lack of funding has been identified as a constraint in the sustainability of a healthy school nutrition environment, it is necessary that we identify additional federal and local government resources to support the nutrition intervention programs. This is a vital component to reducing the childhood obesity crisis. Thank you for your time.